the news is, well, it's not coming tomorrow.
Dr. Kumar is here to discuss new guideline recommendations by the American Cancer Society when it comes to colon and rectal cancer screenings. Good morning, Dr. Kumar. Thanks for joining us. We were talking a little bit about it. Sounds just a tad complicated.
It's more complex than it seems on the face of it. I'll put it that way. Well, colon cancer screening has been around since year 2000. Since we started doing screening colonoscopies. And we've been doing it at age 50 for average risk people. For African Americans, we started at age 45. And people with a first-degree family member, that means mother, father, brother, sister, sons or daughters, with either colon polyps or colon cancer, we started at age 40 or 10 years prior to the age at which your family member was affected with the disease. But the American Cancer Society recently, just last week, has come out with recommendations that the entire process should be started at age 45 for everybody, irrespective of race. And that is big news because that leaves 22 million Americans right now, according to the American Cancer Society, that need to be screened, that are eligible to be screened, that aren't screened right now.
You say there is the matter also of cost.
Oh, yeah. And so just because the American Cancer Society came out with these recommendations last week, one shouldn't expect that if you're average risk and age 46, that you can just call up tomorrow and go get a colonoscopy done or a non-colonoscopy test, and it'll be paid for by your insurance, because this is kind of an early leader in these new recommendations. The way these recommendations come about are with multiple societies, the US Preventative Task Force, the multiple gastrointestinal societies, the colorectal society, along with the American Cancer Society. And this is what, as they call it, a qualified recommendation as compared to a strong recommendation for starting at 50. And the reason it's qualified because there isn't hard and fast data. We don't know really what happens when you look at people 45 to 49 years of age. We just don't have that information. And so they extrapolate data that is available, and they try to make models of what would happen if we started screening earlier. And they do believe that the costs are worth the benefits in terms of life of years gained and the number of colonoscopies performed. Their interpretation of the data is that it's worth starting a little bit early. But, before insurance companies start paying for this, they're going to wait, they're going to mull this over, they're going to wait and see what the other societies that have an impact on this are going to come out with, and then they'll think about it and decide if it's something they're willing to pay for your colon cancer prevention.
I think you described this study, or I should say the American Cancer Society, taking a league and maybe going one step further.
Yeah, it's an early decision. These recommendations are updated and they come around periodically. And just a few years ago, the recommendations are as they stand, starting at age 50. And so the other societies, as far as I know, they have not verbalized any agreement or discordance with this new policy. And so the American Cancer Society is kind of stepping out ahead of the crowd and coming out with these recommendations. So it's certainly going to spur lengthy discussions. And we should say that how these recommendations come around is they have a group of very smart, educated people that sit in a room and they're all looking at the same data, but is it worth the effort? Is it worth the cost? Is it worth the risks? It's kind of a subjective matter, and they vote. And 3/4 of the people in the room vote for it, and these are the recommendations that come around. And each society acts that way. So there isn't a hard and fast rule that this is the right thing to do. But it's very important. I mean, the idea that colon cancer is occurring at younger ages is true. And is this an acceptable strategy to prevent that? The American Cancer Society, a very thoughtful group, says it is. And so we ought to pay heed. And, patients, if they want to have these procedures done, they can talk to their insurance company and see if they'll get on board of advanced screening. But at least expect that you can't just call up and have it paid for. So it's going to be interesting how it all evolves. But the general idea that this is a cancer that's preventable, and that if you pay attention and do something, it's successful when it comes to people above age 50, but then now there's this new group cropping up, people that are less than 50, and this is a very valiant attempt to try to prevent cancer in that group.
So let's say you're a 41-year-old woman who has no history of colon cancer in the immediate family.
Yep.
Because of these new recommendations, is your advice to go out there and get one, or wait until I'm 50?
If you're 41, you're not in this ballpark. You know, no one's recommending what to do for a 41-year-old at all. So you have 4 years to wait before you even have to make that decision. And in 4 years, this will be clarified. This will be, the other groups will weigh in, insurance companies will weigh in. In 4 years, you'll know. But for more interesting, what do you do if you're 45 or if you're 47? How do you handle these recommendations? And currently, you ought to talk to your doctor, you know, or your gastroenterologist, because this gets a little complex, people that are well versed in this kind of data, and weigh the risks and benefits of screening on your own, and also understand that just because you choose to do it, that it might not be covered, and it might be completely out of pocket. You got to know how much that costs.
Talk to your doctor, know the information. If you have a question for Dr. Kumar, email us at askdrkumar@gmail.com. Don't forget, you can like Dr. Kumar on Facebook, Ask Dr. Kumar, and follow him on Twitter as MD Pradeep Kumar. Thank you so much, Dr. Kumar.
Thank you, Amanda.
Great to see you. Coming